Welcome everyone to today's webinar entitled Promoting Healthcare Employment of People with Records, which is sponsored by the National Employment Law Project and the SAFER Foundation. My name is Maurice Emsellem and I'm the Director of NELP's Access and Opportunity Program. I'll be moderating today's discussion. For about the past year, NELP and SAFER have partnered on an initiative to engage healthcare employers in a conversation about the promising opportunities to employ people with arrest and conviction records. Our initiative aims to help expand and diversify the pipeline of applicants seeking healthcare employment to meet the significant demand for qualified workers so that employers benefit from all the amazing talent that their local communities have to offer. Nationwide, about 1 in 3 adults has a record, and 1/2 of all children in the U.S. has at least one parent with a record. So access to employment in the growing healthcare sector is also critically connected to the health and well-being of our communities. With the support of JPMorgan Chase, NELP and SAFER convened healthcare employer forums in the Bay Area, Cleveland, and the Dallas-Fort Worth area to kick off a conversation about the opportunities and challenges of hiring people with records in the growing healthcare field. We're very grateful to our local partners who co-sponsored and organized these forums, which included the Dallas United Way, the Dallas-Fort Worth Hospital Foundation, Towards Employment, the Cleveland Foundation, and Kaiser Permanente. On today's webinar, we'll share some of the lessons learned from these local employer gatherings, and we'll also share some of the resources we developed for the initiative, including our Healthcare Employer Guide to Hiring People with Arrest and Conviction Records. On today's webinar, you'll also hear about the successful experience of Johns Hopkins Hospital in Baltimore, which has been a national leader recruiting, hiring, and promoting people with records. And finally, we'll share some helpful guidance related to the laws that regulate employment of people with records. Before we get started, I'll briefly introduce our today's presenters. First, we'll hear from Michele Sedney, who is the Senior Director for Central Recruitment Services for the Johns Hopkins Health System Corporation. Michele has over 20 years of experience in the healthcare field. She's worked collaboratively with the Johns Hopkins System's 6 hospitals, the insurance program, and the community physician practices and home care programs to plan, direct, and manage recruitment activities. After Michele's presentation, we'll open it up for 15 minutes of questions about the Johns Hopkins program before we proceed with the next 2 presenters. After Michele, we'll hear from Beth Avery, a staff attorney here at NELP who specializes in the employment rights of people with records. Beth will share some of the lessons learned from the local conversations we've had with healthcare employers, and she'll provide an overview of the major laws regulating healthcare employment of people with records. Our final presenter is Sodiqa Williams, who's the Vice President of External Affairs for the SAFER Foundation. The SAFER Foundation is one of the nation's largest nonprofit providers of employment placement and job readiness training exclusively targeting people with records. Sodiqa was the lead writer on the Healthcare Employer Guide. She will summarize the key features of this guide and offer some strategies for HR staff and others to most effectively employ this new employer resource. After Beth and Sodiqa's presentations, we'll open it up again for a final round of questions. The entire webinar will last about 1 hour. Finally, before we get started, I just want to mention a few of the logistics. To pose a question for Beth, Michele, or Sodiqa, please type it into the chat box, which is located at the bottom left corner of your webinar window. You can type it at any point during the presentation, so you don't need to wait to the end to do so. If it's a question that's directed for a particular presenter, please flag that in your note to us. Also, Michele will start off playing a short video clip during her presentation, which you will hear through your computer speakers, not the phone. So please be sure to unmute your computer's audio for at least that portion of the webinar. After the webinar, we'll email a link to a recording of the webinar to everyone who registered and a link to all the PowerPoint slides. So we're going to get started now. Michele, will you kick us off?
Absolutely. Thank you very much for having me. I have enjoyed collaborating with the Safer Foundation and the National Employment Law Project. We wanted to start our presentation today and discussion with a brief video that we produced that really shows why we do what we do to give individuals with criminal backgrounds a second chance. And I think that after you view this video, you'll certainly have a better understanding for why we are so committed to it.
My name is William T. Glover Bay. I work in environmental services here at Johns Hopkins. I was in prison for over 15 and a half years of my life. I really needed a second chance. When I started working here, everything began to fall back in place. I'm so grateful that this organization is taking a chance on people that nobody want to hire. How many people's lives are going to change as a direct result? I have a total of 5 children. They are just so happy that their father's working. And I'm so grateful. Good job.
Proud of you, man. Thank you. I think from that brief video clip, you can kind of understand what it means to us to be able to give people second chances. For those of you that are not familiar with Johns Hopkins Medicine or Johns Hopkins Hospital, we're the largest private employer in the state of Maryland, and we have a mission. When Johns Hopkins created his last will and testament, he indicated that $3.5 million was going to be to go to establish Johns Hopkins University, and that $3.5 million would be set aside to build Johns Hopkins Hospital. And part of that, his last will and testament, was that we were to take care of the indigent, the sick, the poor, to take care of those who have a hard time taking care of themselves. And so we really take that to heart, and really is our mission to go beyond traditional processes for workforce development. And as the former president of Johns Hopkins Hospital, and he is the senior vice president of Johns Hopkins Health System, that we do have a philosophy that we are of the community of Baltimore, and if we need to do something about creating opportunities, because if we don't, who else is going to do that? So through the years, we have developed a 3-pronged approach to workforce development. Many of you certainly already engage incumbent workers, provide them with training and skills to move into other positions that will allow them for better career advancement with higher wages. We also do a lot of outreach with the youth to excite them about careers in healthcare, be able to provide development opportunities, give them the opportunity to shadow. But then we also hire from non-traditional sources to provide opportunities for those with a limited work history. And that's where many of the individuals with criminal backgrounds comes into play. So we do have a commitment to Baltimore. It's consistent with our mission and culture. If any of you have ever been to Baltimore and to the Johns Hopkins Hospital campus, while the Johns Hopkins campus is very nice, it is in a distressed neighborhood within Baltimore City. We truly believe that jobs will help stabilize the community, and we found over 15 years ago that if we were not going to consider individuals with criminal backgrounds for positions with our hospital, then we were really going to have a hard time staffing the hospital. We have found through our efforts that individuals with criminal backgrounds, given the opportunity for a second chance, are so excited with that opportunity and so appreciative of that, that they are very committed to their work and their hospital, and they're great workers. And we've also found that those that had criminal backgrounds, the ones that we have hired, we have not had any issues with them to date. At the hospital, we have what's called a risk assessment team. So if there are any incidences at the hospital that might include an employee with something like theft or drug diversion in the hospital, HR is typically contacted, and we're asked for a copy of their background check for when they first started. And in the time that I have been here in my role, whenever we've been asked for that, that person has had a clean background, and it's not the individuals that we've hired with criminal backgrounds that are getting themselves into trouble. So I know that for many individuals, the guidelines for how do you determine if you're going to hire somebody. The first step in our process is that people complete an application, and we do not request conviction history information on the application process. The Baltimore City did sign ban-the-box legislation, and while not all of our hospitals within the Johns Hopkins Health System are located in Baltimore City, we made a conscious decision that none of our entities would ask this information, even though we probably could have gotten an exception because of the vulnerable population that we serve. So individuals complete an application, they take a pre-employment assessment, and then if their background and their history on their application in terms of their work experience is a good fit for the position that they've applied for, and they completed the assessment successfully, then they may be forwarded to the hiring manager for an interview. If the interview has been successful, then what we do is we extend a conditional offer of employment. And the conditional offer of employment is conditional on the successful completion of the background check process, references, occupational health screening. So no questions are asked about criminal backgrounds prior to that conditional offer being made, because we truly want people to be judged on what can they bring to the table, what is their previous work history or experience or skills that are going to serve them well in the role that they're being considered for. Once that offer has made and we complete the background check, the candidate is asked to complete a disclosure form. We ask them at that point, is there anything that we're going to find? When the background check is run, we have an investigator who is on staff here in HR, and he receives a report every day of all the candidates we have processed for hire who have convictions on their backgrounds. And he researches each and every one of those and provides us with a recommendation as to whether or not we should continue to move forward, or do we need to kind of look at going through the pre-adverse action process. I'll note to you that our HR investigator is a former Baltimore City police officer and former member of the Johns Hopkins security team. We have found his role here within HR to be incredibly helpful. If you're not a lawyer or maybe in law enforcement and you're not used to reading criminal background check reports and understanding what all the different charges and convictions mean, it's really very difficult. And so, we have an expert on staff available to us all the time to be able to interpret that for us, to tell us, is that something that's very serious or not? Because some of the charges and convictions sounds like they're horrible, and he'll be like, oh no, that's not the case. It means this. So that's been extremely helpful. The guidelines that he uses to be able to make his recommendations are basically the EEOC guidelines, in that we look at what is the job that has been offered to this person, and how do the convictions on the background, how are they related to those job duties? How old was the person at the time of the conviction? How long ago it was? Has there been a pattern of convictions or relationship between them? What's their employment history been like? Have they been able to be, steadily employed somewhere for a little while? If they, just had troubles recently, what have they been doing to rehabilitate themselves? Have they gotten themselves into a job training program? What have they been doing? And then in healthcare in particular, it's always a balancing act, because you've got to weigh the decision of us wanting to give second chances to individuals who really deserve second chances, and then looking at the safety and security of our patients and our employees and our visitors. So those are the results that we have. For fiscal year 2016, the hospital had a little over 2,000 hires. 203 of those candidates did have some convictions on their backgrounds, and of those, 126 of those were hired. Of those that were not hired, some was for the background, but for others it was because they got poor references. They may have not been honest on their background check disclosure form, or they may not have cleared our occupational health screening. So overall, about 6% of our hospital hires in fiscal year 2016 were returning citizens or those with conviction histories. So many years ago, a study was done of almost 500 new hires with the hospital who had records, and it showed that they had lower turnover during the first 40 months than other hires. The retention has been very good with these individuals, and like I said, the majority of them are just so thankful that somebody took a chance to show what they could do, that they tend to stay with the organization. And one of the things that we also do that we'll talk a little bit about in a minute is about them being able to take advantage of opportunities for career coaching and advancement. So our anecdotal observations is that we have not had any problematic terminations with any of the individuals that we've hired with criminal backgrounds. The factors for success that I would suggest is that you have to have the support of your executive leadership team. If it were not for Ron Peterson, who's extremely supportive of giving individuals the opportunity for a second chance when it's appropriate to do so, we wouldn't have been doing it for all of these years, and really also encouraging other organizations to do the same thing. You really do have to screen carefully for success, and I think that that's one of the reasons why having an HR investigator on staff is so important. While the recruiters, do their job and they screen and they look for gaps in employment history and they ask behavioral-based questions, our HR background investigator is able to go, behind the scenes with a fine-tooth comb and look at a whole total package for that individual to be able to make those recommendations. Certainly, if you are working with community-based organizations and you have a very good relationship with them, we are able to form those relationships with our community-based organizations so they know what the Hopkins standards are. They know, what kind of work ethic and customer service skills that we are looking for. They are helping to train those individuals in the essential or life skills, and many of them are willing to build pre-hire curriculum to really meet our needs. Other ways to help ensure success that we have used are that we do offer internships and training programs, and that might be referred maybe from Department of Social Services or other programs. And those individuals are interviewed prior to those internships and training programs as if they were being hired. And we use those internships as trial employment periods for individuals. One of the other factors for success that I would want to mention that's not here is that unless there's a need to know, we do not share information with the hiring manager or the department about whether an individual who is being hired in their department has any sort of criminal convictions. We truly believe that we want everybody to start on the same level playing field with no preconceived notions, and I think that is important. As I mentioned earlier, once individuals are hired with Johns Hopkins Hospital, they are able to take advantage of career coaching services and career development services. So if an individual wants to request case management type services, they're able to do that and meet with a coach. If the individual is having trouble maybe adjusting to working, if maybe they haven't been working for a while, the coaches can act as liaison between the employee and the department when needed to kind of make sure everybody's on the same page and that things go smoothly. Certainly provide job retention services, and then can really work with the individuals. If they say, I'm glad I got this job in environmental services, but my goal for the future is to go beyond that they can sit with a coach, and the coach helps them build a plan of and they have them take assessments to determine what their career interests might be, what they might be good at, and then helps them build a plan of what sort of training classes or certification classes should I be taking? What do I need if I want to become a rad tech, and how am I going to get there? And those coaches help those individuals. This is not something that's mandatory. These are services that are available to any of our employees. The other initiative that Johns Hopkins has is called Hopkins Local. And Hopkins Local is a commitment from Johns Hopkins University and Johns Hopkins Health System to build a stronger Baltimore by looking at, how can we stimulate economic activity and economic growth within the city of Baltimore. And we are doing that through 3 different components: the build component, the hire component, and the buy component. In addition, when Johns Hopkins started Hopkins Local, some people, I guess at the board level, were talking about it with other organizations within Baltimore, and they said, wow, that sounds really great that you've committed to goals in your build, your hire, and your buy. We might want to get into that too. But the build local requires that when you are building and you're doing contracts with contractors, that there is a clause in the contract saying that the builder is going to do some local hiring and demonstrate good faith efforts to do that. And there's typically a percentage of, to say, 5% of the workers assigned to this or whatever are going to be from the Baltimore area. And we have actually identified 16 zip codes within Baltimore City that are within the most distressed neighborhoods of Baltimore as our targeted population for all of our Hopkins Local initiatives. We also are looking to increase the work that we do with minority women and disadvantaged businesses. For the higher local part of Hopkins Local, as the area that I'm directly involved in, is that we set a goal to ensure that at least 40% of our new hires for targeted entry-level jobs are from those 16 focused area neighborhoods. And our targeted positions include truly entry-level positions like environmental care, food services, linen workers, transport associates, those types of positions. And I can tell you that the first year that we were doing this, we hit 42%. I think the second year we were about 45%. And this fiscal year to date so far, we're probably at about 48%. So we have been able to go a little bit past our goal for hiring locally. And then the buy local is that we really want to increase purchasing from Baltimore City businesses, especially women and minority-owned businesses, and create plans with non-Baltimore City suppliers to invest in the city. And in fact, there have been some companies that have actually moved into the city as part of this initiative because we've created plans to help them to do that. They've been really creative with trying to increase purchasing from Baltimore City residents from the departments within the Johns Hopkins Hospital and University. You know, one of the big purchases that everybody has is food or catering expenses. And so they had all these different vendors come and just do a little expo where, you know, you could get a little sampling of all the foods. So they found some really very creative ways to ensure that those who work within the Hopkins system are aware of this and have an opportunity to participate in some way, shape, or form in these economic inclusion initiatives. So the impact of this is that, you know, I was wrong. 50% of our workers for the system in FY 2016 were from our targeted entry-level jobs in those focus area zip codes, and because of the area in which those zip codes are located, some of the most distressed zip codes, we knew going into this that we were going to have a lot of those candidates would be candidates with criminal backgrounds. And so 115 of those individuals did have convictions and were hired by us. All right. So at this point, you know, hopefully this gives you an overview of the work that we're doing at Hopkins, and I'm more than happy to answer any questions that people might have.
Thank you. Thank you very much, Michele. We do have a couple questions, and again, I'll just mention again, if you have any questions, just type them into the chat box down there in the left-hand corner, and we'll be sure to ask the presenters. So one question, Michele, that came in relates to the types of positions that are available. You mentioned a little bit about that earlier, but the types of positions that you're hiring into, and then maybe if you could say a little bit more about your experience in advancement and promotion of folks who've been hired.
Sure. So for the first 2 years of Hopkins Local, I mean, the positions are mainly entry-level positions of environmental services, food services, transport associates, but we also have some positions in there like certified medical assistants where they actually, you know, need a certification for those types of positions, and some of our clerical front desk registration type positions. This coming fiscal year, we're going to be adding some positions to that, including our community health worker positions and our peer recovery specialist positions within the targeted entry-level job grouping. We have seen that from the individuals hired in those targeted entry-level jobs, that I would say at this point about 5% of them have actually since been promoted into other positions. What's neat, what's happening is that, you know, if somebody starts in environmental services and they do a really good job. They've got a really good attitude, great customer service, that the nursing managers are getting to know them, and when they have openings on their floors for positions like customer service reps or unit associates, that they're kind of tagging them and saying, hey, I have this opening, why don't you consider applying? So it's been going very well.
Great, thank you. Can you, you mentioned before that career advancement support services are available to all employees, I think. Is that correct? And
That,
trying to get
that
folks
is
are
correct.
asked. Okay, folks
Yeah,
are
that is,
interested in whether. Go ahead. Sorry.
I was going to say that's correct. I mean, those services are available to anybody that wants them.
And then how do you handle? We talked a lot about entry-level positions. Other positions that are not strictly entry-level. How would you say that folks with records are making it into those positions as well?
Absolutely. While the majority of people with criminal backgrounds are in entry-level positions, there are certainly people who have been hired into positions in management positions, materials management, IT, some clinical areas. It just depends upon the position and what that conviction is. So, it's not just limited to entry-level positions. And we have so many people, while we work with community-based organizations and they refer candidates to us, there are just so many individuals with criminal backgrounds who just organically apply directly to us.
Okay. Another related question, then I'm going to switch gears over to the contractor and the Hire Local initiative. It sounds like the career services help folks advance in positions once they're there are available to all employees. Is that right? Not just the folks who are hired through Hopkins Local?
That's correct. Anybody who is interested in meeting with a career coach or coming and talking about, can you help me with my career path, or what kind of, training and education should I be getting into, all of those services are available to any employee that seeks it out.
Okay, great. And then just one more question, switching gears to your contractors. So it's great to hear this very comprehensive initiative to engage businesses in the community to be supportive of these efforts to hire locally. Can you say a little bit more about what you're doing there with your contractors? For example, the question was asked if you're creating any expectation that the contractors will also ban the box, also follow some of your background check policies.
So if there are contractors who are supplying workers to us, they absolutely are required to do background checks. And if they are considering placing an individual here with a criminal background, our contract with them states that they're to let our HR background investigator aware of that, so he can review the background and just give them an all clear for that. But we don't require contractors to include, we don't include anything in our contracts that they also need to ban the box or anything like that. But we do, put in the contracts about commitment to hiring locally.
Okay, great. Thank you so much, Michele. I think we'll switch over now to our next presenter, Beth.
Thanks so much, Maurice. Great. It was really great hearing from Michele Sedney. We always love partnering with her, and she has great information. If you think of a question later for her, when at the end after Sodiqa and I present, you can flag another question for her, and if she's still on the line, we'll relay that to her just in case you think of something later. So as Maurice mentioned, way at the beginning of this webinar, if you were on the line, NELP and SAFER held 3 healthcare employer forums in late 2016 and early of this year with the support of JPMorgan Chase. We co-hosted with fantastic organizations in each of the cities and had the chance to connect with a wonderful group of employers in each city. And it was a great experience. And from that, we learned some lessons. The conversations we had with employers revealed and underscored numerous facts and concerns. Some we were already aware of, some that were new. And for one thing, it was underscored that a local champion in the city or state, someone like Johns Hopkins or Kaiser Permanente here in the Bay Area, who co-hosts the forum in Oakland, like Safer Foundation in Chicago, who's an intermediary there. Someone local championing this issue is key to getting the conversation going about hiring people with records. Employers want to see what other employers are doing, hear how it's going, compare notes, and have an opportunity for that. Also crucial is a champion of this issue within an organization. So Michele Sedney mentioned that she had buy-in at the high levels of Johns Hopkins when they first started looking into this issue. Both from Michele's predecessor as well as the president of Johns Hopkins, and they made it an explicit part of their mission. And that's really key for top-down support in order to get something going within an organization. So if that's possible, it's certainly wonderful. More generally, we learned that folks were interested in this topic and want more information. There's a huge need for healthcare workers, as I'm sure you're aware, and people are looking for ways to fill those openings and are interested in learning how they can incorporate people with records into their workforces. And you can see a list here, but many, they wanted pretty specific information. They wanted best practices, responsible contractor policies. We were just talking about that with Michele. Laws and regulations, more information about them, and a better understanding of negligent hiring. Now, a lot of that information varies by state, and we'll get into some of it later, but a lot of it's going to be specific, and so, local organizations will hopefully be able to provide more information more specific to each state. We heard that people want to be paired with local intermediaries to help them find talented and trained workers with records. Oh, in addition to, hearing the, concerns and interests from employers, we've also taken a look at the relevant legal considerations nationwide as a part of this project, and I'll turn to those in a moment. But before I dive in, I think it's important to appreciate the size of the population that we're talking about on this webinar, and Maurice hinted at this earlier. But 70 million people nationwide have an arrest or conviction record. That's nearly 1 in 3 U.S. adults. Now just pause, because that is a huge number, and a lot of people don't believe it. And we calculated that using Bureau of Justice Statistics data and Census Bureau data. And, when we think about people with records, it's easy to visualize someone, some stereotype of a criminal. But 1 in 3 U.S. adults, we're talking about members of our communities, parents, grandparents, neighbors. In fact, it's estimated, as Maurice mentioned earlier, that nearly half of all American children have at least one parent with a record. So this is an issue that's affecting a lot of people and that we should all be taking an interest in. And records are disproportionately concentrated among communities of color. As you can see from this chart, African Americans are incarcerated at over 5 times the rate of white people across our country. And arrest rates are similarly disproportionate. Now, what's especially important to remember here is that this difference can't be wholly attributed to just more criminal behavior among communities of color, but also to over-policing, over-criminalization. And, just for example, studies have shown that while rates of drug usage are essentially equal among white and black people, arrests and convictions for drug offenses are much higher in the black community. So this is just some very important background information. And it's because of this disproportionate, or otherwise called disparate, impact on people of color, federal civil rights laws that prohibit employment discrimination, Title VII is the biggest one, they prohibit employment discrimination based on race, also require employers to take a careful look at their background screening policies. Now, the agency that enforces federal civil rights laws, the EEOC, issued a specific guidance in 2012 on the lawful ways to consider conviction records when making hiring decisions. Essentially, an employer violates the law when its criminal record screening policy disproportionately screens out people of color. So at one extreme, a blanket ban screening out all people with records would violate the law. In addition, the EEOC says that because, an arrest doesn't prove any wrongdoing, innocent until proven guilty, we heard that, arrests may not be used to deny employment. And employers are also instructed by the EEOC to consider three pretty common sense factors when you're considering a conviction record. The nature of the job, the nature of the offense, is it related to the job, and the time elapsed since the offense, did it happen a long time ago? And the EEOC says to take an individual assessment of those factors and look at individuals and not make blanket assessments. Federal consumer laws also provide some limits on considering conviction records. So background check companies, also called consumer reporting agencies, as well as employers, have duties under this law. Most notable for employers, employers must provide notice and obtain permission to screen an applicant's background. They must provide the contact information for the screening company, and they must offer a copy of the report and time to correct it. Now that last piece is very important, time to correct it, because about half of all FBI records are incomplete or inaccurate. So, giving people the opportunity to correct records and know what you're judging them on when you're considering applicants is crucial. State laws also provide some limits on what records an employer may consider. And now this is going to vary by state, and not all of you are from one state, so I'm going to make some generalizations and give some examples here. But for example, some states supplement the federal law that I was just talking about, the federal consumer law, with state consumer law limitations. For example, in Texas and California, background checks only go back 7 years for arrest records and for most convictions. Expungements and sealing is another important state limitation. Essentially, these are legal terms, but essentially they allow people to eventually make certain records unavailable through employment background checks. It varies by state whether you're able to expunge convictions and what type, or whether you're only allowed to expunge or seal arrests not resulting in conviction or just pardoned offenses. It's going to vary by state, and you can visit that link I have there to see a 50-state comparison and look at the information for your state. But there's certainly a trend across the country toward expanding availability of these mechanisms. Just to give you a little insight, between 2013 and 2016, at least 27 states enacted laws, some creating new schemes and others expanding existing expungement and sealing. So this is luckily becoming more common. Certificates of rehabilitation or certificates of relief are another option in some states. They're basically something extra that a person can point to show rehabilitation. And there's also a trend toward expanding availability in that same period, 4-year period, 2013 to 2016. About 8 states created certificate programs. And now I should flag, though, that one unintended consequence that can come from certificates is that sometimes employers start to think that they should only hire people with certificates if they're available. However, it's important to remember that unless a law prohibits you from hiring someone unless they have a certificate, you should consider a certificate as something extra to make the person's application more competitive. Because it can often be hard to obtain certificates. Maybe you need a lawyer, pay certain fees. There's a long waiting period before you're eligible. So keep all those things in mind if you're in a state that has certificates. Now, there are, of course, certain background check requirements in healthcare. The federal restrictions are fairly limited. The most dominant one is tied to funding for Medicare and other healthcare programs. Essentially, it just says you can't hire excluded individuals. And now, maybe wondering, what is an excluded individual? It's pretty easy, though. Basically, the federal government puts out a database, the list of excluded individuals and entities, LEIE. It's free, it's updated monthly, and you just see if someone's name is on there. And if they're on there, then they're excluded. And if someone thinks their name is on there improperly, there is a way to, challenge that and try to get the name off. When does someone end up on that list? Well, there are only a few mandatory exclusions, and those offenses are related to healthcare. So patient abuse, healthcare program offenses, financial misconduct related to healthcare programs, and drug felonies. And and the typical exclusion for that is 5 years. And there are a few mandatory exclusions, but again, just all you have to know is if the person's name is on that list. There are also state restrictions at the state level, and most are tied to occupational licensing. So licensing laws vary widely by state. And although healthcare is typically heavily licensed as compared to other occupations or sectors, there are, of course, certain jobs that typically don't require a license. Licensing boards often require background checks. So even before a person gets to the employer, if they have a license, it's almost certainly gone through or probably gone through the background check process with the licensing board and already, possibly jumped through a bunch of hoops and tried to prove their rehabilitation, et cetera, to the licensing board. So that's important to remember. But the restrictiveness that licensing boards apply when they're running background checks really vary widely by state and by occupation. Overall, most licensing boards have fairly vague but discretionary standards, and there are some mandatory exclusions. And a mandatory exclusion versus discretionary just means, does the licensing board have to exclude someone from getting a license, or do they have discretion to award the license or deny it? Now, applicant protections under these licensing laws also vary widely, again, by state and by occupation within states. It's really just a labyrinth of these laws across the country. But my NELP colleague and I evaluated the overarching state standards. So we kind of looked at, okay, our overall, how does the state fare, or if they have an overarching law. And we found that, there aren't great applicant protections to ensure fairness across the country. So this is an area where our laws could do some improvement, to help people with records be treated fairly when they're applying for these occupational licenses. Essentially, we looked at whether, there were automatic bans, whether the licensing board looked at those EEOC factors I mentioned earlier, whether licensing boards are required to consider rehabilitation, and, whether licensing boards are allowed to consider arrests and those expunged or sealed records that I mentioned earlier, or whether they can't look at those. You can get a quick sense of your state from the chart here, but you can certainly visit the report for more information and know that it varies by state and occupation. Even within a state, it varies by occupation. All right. I'm going to ask everyone to wake up because before we move on to the next topic, I'm going to take a quick moment to ask you to answer the following multiple choice questions. You can just click it on your screen. What I'm going to ask you is going to tie into what we're going to talk about next. So how concerned is your healthcare organization or company about negligent hiring liability resulting from hiring workers with records? Are you very concerned? Somewhat? Is it not really something you're worried about? Are you not even sure what negligent hiring liability is? Or, if it's not applicable, if you don't work for a healthcare company or organization, feel free to click that. So I'll just wait a few more seconds while people, click your options, and then I'm going to skip to the results. So pause briefly. Okay, so it looks like we have a decent number of people, who are not applicable here, but also, a good number who are quite concerned about negligent hiring. And it's good to know, and it seems like people's impressions vary fairly widely. Well, I'll get into the next topic, which, as you may have guessed, is negligent hiring liability. Okay, so first, what is it? Some people said they weren't even sure what it is. Negligent hiring is a lawsuit. It's a lawsuit that a person can file against an employer for an injury that was caused by an employee. And so, one thing that's important to know is that these lawsuits are a lot less common than you might expect, and also extremely important to note, they're not just tied to, workers with records. Most cases that are reported, so most cases that occur in the country, most have nothing to do with an employee's criminal record, because a person without a record can injure a customer or a coworker or something like that as well. And it's not just people with records. That's important to know. Also important to know is that these lawsuits are a lot harder to prove than you might think. It's not enough to just point to the fact that somebody has a record. You need to show that the employer, so if I'm filing a suit like this, I need to show that the employer should have known that the employee was dangerous, not just that they had a record, even if that record was for a violent offense. And I would need to show that the employer, ignoring the fact that the employee was dangerous, caused my injury. Now, in addition to the fact that these are a little, that these can be hard to prove and aren't as common as people think, some states actually go further and have passed laws to limit when such lawsuits can be brought because of an employee's record. So the laws basically just make it clear an employer can't be found liable just because an employee had a record. And you can see the list of those types of laws there. And you can certainly follow up with me after for more information. All right, we're getting near the end of my part. So I'll just touch very quickly on ban-the-box fair chance hiring laws, just to make sure you're aware of them. Now, ban-the-box refers to the checkbox on job applications to ask you if you've ever been convicted of a crime. We heard earlier that Johns Hopkins does not ask on the initial application, doesn't ask until after a conditional offer, whether a person has a conviction or arrest record. So fair chance ban-the-box laws require employers to delay those inquiries. And they sometimes also require that certain consideration, like those EEOC factors I keep mentioning, some of these laws also require employers to consider those. So employers can ask about a record and consider it later, just not up front. And now nationwide, about 20% of the population lives in a jurisdiction where private employers must delay such inquiries. So 28 states have them in general for public or private, and 9 states and 15 localities, so cities and counties, have them for private employers. Okay, last slide, and then we're turning over to Sodiqa. Just real quick, I'd be remiss if I didn't point out that there are some incentives available for hiring people with certain records, including a federal tax credit and free fidelity bonds. And fidelity bonds are a type of insurance for if an employer experiences loss because of misconduct by an employee. Some states also have additional tax credits, and for more information on this topic, you can visit the links at the bottom, and we'll be sending this around after the webinar. And with that, I'll turn it over to who's next.
Thank you, Beth. Just want to remind folks, if you have questions for Beth or for Sodiqa, please type them into the chat box. We're going to move on to Sodiqa's presentation. We may end up extending beyond the hour just a little bit, so we just wanted to flag that for folks. Sodiqa?
Thanks, Maurice. It really is a pleasure to join my colleagues for the webinar today. We were told a little bit about the SAFER Foundation earlier in the webinar, but just to kind of rehash, I'm the Vice President of External Affairs, and SAFER has been around for over 45 years now as one of the nation's largest community-based organizations that help people with arrest and conviction records gain employment, as well as the supportive services that are related. SAFER Foundation became interested in the healthcare field when we were exploring launching what we call the SAFER Demand Scale Collaborative in the community. And what that does is it looks at how intermediaries like SAFER can work with employers to fill jobs where there's a big shortage of qualified workers, but you have tons of people that can be actually ready and available and qualified and trained. So we wanted to figure out how could we train our clients and work with them on the soft skills to get them prepared for the largest growing industry. And so we held a healthcare forum in Chicago, May 2015, and it was an excellent response and feedback, which is kind of how we started and where we are today. And we actually have launched a healthcare collaborative in Chicago, so that's how I was kind of brought into this larger initiative. I am the lead author on the toolkit, but it was definitely a team effort from the folks at Safer Foundation as well as NELP, as well as those who are on our advisory committee, including Michele and other national experts in the healthcare field. So I really, urge you to read it. This is an excellent resource for you. And it can be used whether you're just kind of here today to learn more, or if you're kind of already hiring people with records, and you want to know about some of those best practices. I think that, which are great things that Hopkins shared earlier in terms of how you can be that career coach for your employees, leading to better retention and career laddering. So I urge you to read it. And fully digest it so that you can be a champion within your organization. And so when you are, you've read it and you understand it and you're like, yes, this is exactly what I need to do to improve my bottom line and to fulfill my mission, my organization's mission to improve health outcomes and to also improve the local community for my organization. You also have to look, okay, if you have that top, the top support among the leadership in the HR, you also need to kind of dispel some myths. And Beth did a good job of covering one of the most prevalent ones, which is that you'll be exposed to substantial negligent hiring liability. We heard that a lot in the healthcare forums from different employers, as well as, people with records won't be reliable employees. People with records, those records are actually shown to have higher retention on the job and have been promoted at a higher rate than other employees in some examples. And that's really, when people with records, they just want a chance. They just want the opportunity to show that, they are more than capable, and you just have to give them a chance. So that is a big myth that when you're kind of working this and you're talking amongst your organization, that you can use the toolkit to you can print it out, the electronic copies, and say, hey, actually, take a look at this, and we've provided the footnotes. You can say, okay, this is the study that they quoted. Another myth is that federal and state laws regulating healthcare employment prevent my organization from hiring people with records. And that is actually, I was very surprised to hear for the first time at the Chicago Forum just how many healthcare employers believe that, because I do know, especially in Illinois where the Safer Foundation is headquartered, we have some pretty complex state laws that needed to be clarified, and I'm happy that we actually have pushed a number of local initiatives, local pieces of legislation that actually address that. But they do not absolutely bar you or preclude you from hiring. Actually, there are certain laws, and I think Beth mentioned this, and regulations that allow for waivers for people with records to be hired within the healthcare industry, and it really is based by statute. It can be totally different for different licensing in terms of what's precluded and what's not. So you really need to kind of understand the state laws. And once you get an understanding of, okay, now that I know how, what these common misperceptions are, then you need to think about, okay, what are the bottom line benefits? When we think about hiring people with records, a lot of times, we definitely want to advance the hospital's mission for better patient care and community health outcomes. But, when you're dealing with a high rate of individuals with arrest and conviction records, you have to understand now it becomes about also how, as an organization, as a company, can I recruit the volume of people I need to sustain the high volume of jobs that are opening up? So, I mean, there are a number of benefits, and you can go over them in depth as you're kind of going through the toolkit, reducing your recruiting costs, especially when you're working with intermediaries who can kind of help you look for the talented, qualified candidates, as well as advancing your corporate social responsibility, diversity, and compliance and employment laws. You're reducing turnover and increased productivity, because if you think about you're doing a local hiring initiative, if that's what your focus is, you're looking within the communities surrounding your hospital, and most likely a lot of them have records. Like in Illinois, I'll speak back to where we're from again, you have 4.1 people with arrest and conviction records in the state of Illinois. That's over 40% of our population. So if you're looking to hire from the community, most likely we'll have people with records in the community. So if you're looking to hire them, you're going to see as well, you're going to see better health outcomes, and you're going to see an improved quality of care, especially if the people from the community are, are actually working on your staff. They're going to be able to relate better to the people that are actually coming into your hospital or your community health center, and they know how to talk to them, they know how to relate to them better. And as well as the tax credits and cost-free employee insurance that you heard Beth mention earlier. The toolkit also, I don't have a slide for this, but I just wanted to point out, please also look at the success stories. We are featuring, there's a lot of success stories in here, but Melody Young is kind of in the beginning. She actually came to our forum, and she had everyone, just very much, I think the room got silent with her story. Here she was, a person, she had previous drug conviction, and she really turned her life around. She came to SAFER. We helped her get what you call a healthcare waiver so that she could work in the healthcare field. And today she is an LPN, and she's very successful, and she's active in her community, and she's just a real success story. The toolkit also is good if you're in terms of looking at your internal hiring process. Again, you can look to the toolkit. You can walk through these individual steps. I also encourage you to look at the hiring manager's key for hiring people with arrest and conviction records. As we kind of, SAFER keeps on walking through this process, we're learning the importance of the hiring managers in terms of understanding, as well as the HR staff and the leadership, the value proposition of hiring a person with a record. And when you have so many applications coming in, it's good for them to kind of, it would really depends on what your company or organization prefers. If you want to engage the hiring managers within your process, as Michele indicated before, Hopkins does not. Kaiser also has a background check process, and they do not include the hiring managers after the conditional offer is made within that background check process. So I urge you to look at that as well. You also, and I'm sorry, there's the hiring manager's key. You also can learn from model employer practices. You saw the slides earlier from Hopkins where they share the best practices. There is also information on if you want to hire community health workers. That's included in the toolkit for you to read. And there's also information that you can really get an understanding of, well, what should my relationship look like with an intermediary? I think this is a great section. So once you're looking early in the toolkit in terms of, okay, internally, how can we improve our process, but also how can we leverage those community relationships? So I urge you to kind of look at this and fully digest it. And I'm sure, like the others on the webinar, I am willing to take questions today and later. So that's the toolkit. One of the things that, we were asked to reflect on the lessons learned. And the toolkit really is a great first step among leadership and HR staff. From the work that we've done at SAFER and the SAFER Demand Skill Collaborative, we are learning that healthcare employers, to be truly effective, need training for hiring managers and functional staff because, we have the leadership ready to engage. We have the HR staff ready to engage, but we have to make sure that the functional management and the hiring managers understand the value proposition as well. So technical assistance is highly recommended for the internal hiring process. So if you're an employer and you choose to implement the Johns Hopkins model where the HR department doesn't share information regarding the applicant's criminal background, this may still put the candidate in a position if they're speaking with a hiring manager where they have to explain their gap in work history, right? So this really shows the importance of the intermediary to work with candidates to help them articulate their criminal record and convey their rehabilitation. And also, I think that's another reason why you really should try to develop some relationships to be successful, because they also will probably need some coaching on how they can relay, different skills and how it applies to that context, especially if they have gaps in that work history. But for employers, it means that functional management, managers, and supervisors may need that technical assistance training and implicit bias and kind of asking the correct questions. They may stumble in areas where they may not legally be able to ask those type of questions, depending on if you're a state with ban the box or a municipality. And the toolkit is a good tool to initiate change management within HR, as well as training, educational policies, and how to navigate laws and best practices. However, while these changes are getting translated in the pre-screening process, again, they might not be trickling down to hiring managers. And so just something to point out as an example, because I've been talking about how it's got to trickle down. Once you digest this and truly understand, running through the toolkit, SAFER with our healthcare collaborative, and I work pretty closely with the SDSC team that's actually working within the healthcare field in Chicago. Some of the lessons they've shared for me is that we have high referral to referral ratios from the intermediary to the employer. But the referral to hire ratio can be lower. And the reason why it can be lower is what I was talking about with the functional management and how they need to be trained in terms of how hiring people with records will improve your bottom line, and as well as the value proposition. And also internally, it needs to be worked out, okay, how does my process, if I'm working with an intermediary as a referral organization, do I flag them? Are they lumped in as a whole? How do I know? How can I know that the candidates that are coming in are from this, trusted community-based organization or faith-based, whoever you're working with, so that way they're not getting mixed with all the other candidates as well, if that is something that you prefer. So there really needs to be some work, and I encourage you, as you're talking to intermediaries or if you're an employer, that you definitely don't just have the leadership in the HR, but also the hiring managers and the functional management are at the table. And this is my last lesson learned. There is a danger that intermediaries can become the box in a way to screen out applicants in jurisdictions where there is ban the box. And employers will not interview candidates that are referred. Intermediaries and collaborative partners should exercise discretion to use strengths-based approach with the mindset of the end goal being to fill new talent into an aging workforce and a stationary cannibalized pool. And I just want to just stress this out here. You have 70 to 100 million people in the United States. That is a pool that you can tap. With the increasing laws, you have ban the box, you have occupational licensing reform, you may have ceiling bills. You've got to just take non-traditional approaches to look at this population. And the hiring policies in the toolkit, the best practices of employers, and the best practices like Hopkins employees with the career coaching, career laddering, you should really, really consider. because we need to be more inclusive rather than exclusive in this environment, as you know, in this tough economic time, and when there's this high demand but there's a shortage, there's a skills gap. So if we put the less discretion on the front end in terms of corporate policies and mandatory barriers, we have the less talent to pick from in the back end. So just when you're looking at your barriers that you've kind of put in the front end, just understand that in the back end, you're going to see less benefits. And so I just want to open it up for questions.
Thank you, Sodiqa, very much. We are running a little bit over time, so and we don't have a lot of questions at this point, but I guess I want to remind folks, you can send us your questions by email, and the questions that we didn't get to earlier that we'll send in, we'll be sure to reply to them as well. So feel free, to ask any additional questions. I think we'll wrap it up now. As I mentioned, after the webinar, we'll send everybody a link to the recording. We'll resend the link to the toolkit, and you'll get also a link to all the slides that have been provided. And we hope this has been helpful, and that the information we've shared, the resources we've shared, will be of use to you all. And again, thank you, and please follow up with any additional questions.